Welcome back to another episode of Black Fact because we get an opportunity to engage in a conversation with Miss Leticia Vaca Williams. She is a licensed clinical social worker and she's the CEO and founder of Urban Health Group. Urban Health Group is a team of licensed counselors and psychotherapists that specialize in mental health, and they offer a variety of services for individuals and groups in the Greater Bay Area, with a particular emphasis on BIPOC health and wellness. And that's why I wanted to have Leticia on today. Welcome. I'm
Thank you.
so happy to have you on this episode of Black Facts and be able to talk to you about the importance of the BIPOC community engaging in healthcare, accessing healthcare, and how we go about doing that. So, welcome again.
Thank you. Thank you.
And I wanted to know, from your perspective, why is it essential for our BIPOC community to understand how to navigate the healthcare system?
Yes, so my time working as a medical social worker in the ER and ICU, I got to see a lot of folks here in Oakland at a trauma center. So folks came to the hospital for a number of just different reasons. And I saw that folks were not prepared, not on their own doing, but things are happening really quickly and sometimes their needs not getting met. So from a firsthand experience, witnessing things are moving really quickly and sometimes errors happen. And so really wanting to connect folks to how can you move through the system and get your needs met, get your desires and your wishes heard. And so we know from research that members of racial and ethnic communities outside of the white community are less likely to receive preventative health services, oftentimes receive lower quality care. And if you can, look at all the numbers from the CDC and the Kaiser Foundation, tend to have worse health outcomes for certain conditions. So the likelihood of going to the hospital, needing support, the likelihood of receiving lower quality care makes it essential for Black, Indigenous, people of color to really understand how to navigate the system. And so you really have to be your own champion and advocate. And I'm happy to talk about, ways that we can do that.
Yeah, so I just wanted to go back to something that you said that you worked in a trauma emergency room. So, did you find that most of the individuals of color that came into that space that it was kind of like as a last resort, like, oh, I'm at my wit's end or I'm in a really bad health situation, and so they presented in the emergency room?
Folks tend to, well, in a trauma center, there's actually not a lot of them. And so when we think about navigating the healthcare system, all hospitals are not created equal. So a trauma center really means that they have certain professionals who can provide a service that is not offered at other hospitals. So when we think about navigating the healthcare system, one is understanding the different types of hospitals, the different types of services. So in the ER, there's some people who come as a last resort, but there's also people who are going to the ER for tummy aches or small cuts or cold symptoms. But we see people from automobile accidents or injury at work, something traumatic we've seen in the community, like when we hear of those mass shootings, when we hear of things happening at schools or big fires, they tend to go to trauma centers. So you see people with a number of different medical and sometimes psychiatric conditions.
Well, I appreciate you saying that there's a difference because that's what I was wondering too. Are we presenting at the wrong places to seek
Some,
out healthcare,
sometimes,
right?
the ER is a good option because they tend to have access to all the professionals. So that could be a psychiatrist, that could be a surgeon on the team. So the ER is the last resort, but they do offer a lot of great resources. There's ICU, there's urgent care, there's outpatient, there's urgent care clinics. So when you have a need that requires emergency services, meaning life or death, I don't know if this is a heart attack.
Right.
I don't know if this laceration is a major vein, a major vein that's been cut. Do go to the ICU, to the ER, to the emergency department.
Okay.
Now, if you have a cold, you have some other kind of pains, contact your primary care doctor. Now, for folks who are not connected to a primary care doctor, you can go to an urgent care clinic. You can call Advice Line to learn, should I go to the ER? So I always tell folks, call the Advice Line. And that tends to be on the back of your insurance card. There's some local community ones. If you're not connected to a doctor, call the county hospital. They tend to have a advice line, a nurse who can help you triage and say, no, babe, you need to come in right now, or let's find you an appointment that you can go to next week.
Okay. So let's reel it back. We're talking about trauma and showing up, in case of emergency, right? Let's talk to our people about being prepared.
Yeah.
So I want to go to a doctor's appointment and I want to be prepared. I want to be able to confidently advocate for my healthcare needs. What
Mhm.
steps should I take?
Well, if you're scheduling appointments ahead of time, you are already ahead of the game, right? So, folks who are doing their routine physicals or their mammograms or whatever's required routinely, good for you. For the folks who haven't quite done that, and a lot of people didn't do that during COVID, me being one of those, but you want to set an intention. What do you want to get out of this appointment? Is it, I just want to make sure nothing's going on. I want to make sure my blood pressure is managed. So set an intention for why you are going to the doctors. Is it to manage a diabetes or your heart failure or COPD? Do you have questions, right? So when you make that appointment, say, I want to get this out of my appointment. The other part is making your information known. That is one of the best things you can do in collaboration with your doctor as you prepare is let them know the new symptoms or the reactions you may be having to certain medications or new pains that are presenting. So make sure you let the doctor know what's going on. Having a little notebook, because we don't see the doctor that often, of when you can kind of track and manage. This new pain started in September, right? Has it been going on a year or is it something that kind of comes and goes? So keeping a notebook about new issues or things that are actually going well. You might have changed your diet or tried a new supplement. You do want to keep your provider in the loop even when things are improving and getting better. So having your questions prepared to say, hey, does this counter interact with this medication? What should I be mindful of? So making your information known, but also having some questions prepped for your provider. You also want to potentially loop in your support system. This is really important for people who are living with chronic conditions or aging or elders. Do they need transportation? Do you need someone to help you organize your medications? Is it becoming harder to read the labels? So there may be times where you need to loop in your support system as you prepare for your doctor's appointment. You may be forgetting some of these things that you can tell your best friend or you can let your adult child know. Hey, can you let the doctor know these things in the case that I might forget? You can even ask them to come to appointments with you. If you don't have a person like a family member or a friend who can help you prepare, you may need professional support. So that's where a case manager or a social worker can come in and be that support system as you're managing your health condition or trying to maintain your health. Um,
So, Leticia, with that, would I ask, when I call to make my appointment, I mean, I feel like I need that additional support, like you said, would I ask then? Or do I ask my doctor if they can give me a case manager or somebody that can assist me?
I would ask your doctor because you always want them to know who's involved in your care. in the case that they can't reach out to you, if a social worker is involved in, and I do want to give a plug for social workers since I am a social worker in a social work month, but they're really helpful in helping you advocate, being a broker between you and your provider when sometimes the message is not clear, or sometimes feeling like you're ignored. You can have that extra backup as a social worker to say, hey, they're trying to coordinate. We're finding that their functional status is becoming more difficult and they need more support at home. So, for folks who have limited support or very poor support, have difficulty um, having reliable people around, seeking professional support is a really good option. And all hospitals, one, have medical social workers on staff. So they're in the ER, they're in the ICU, they're in the inpatient. They don't always see everyone, but you can always ask for one and they will send someone your way to get you some support.
Okay, so that's good to know. So I think most people tend to think if they've encountered a social worker or some other professional that it's usually a bad thing,
Yeah.
right? So I love that you're shining a light that no, medical social workers are in these spaces to be supportive and to be helpful as well, to help you navigate, right? The healthcare
That is
system.
our sole role as medical social workers, is to help people cope with the hospital experience and help advocate for them and connect to resources if needed. So, social workers sometimes get a bad rap that if you're in trouble, they're sending someone to your room. Our responsibility is to keep the community safe, and sometimes there are further things that need to be done to support either children or elders, but we have so much more skills in providing like brief counseling and support. So when you're really overwhelmed or you're disturbed by an experience you had in the hospital, you can talk with the social worker. They can help you either file a complaint or actually build a better relationship with your provider.
Hmm.
So we are brokers in that sense, in making sure you're connected to the appropriate level of care and have the adequate resources to do well.
I like that. So I like that you saying you're a broker. You can help them engage and have a better relationship with their provider.
Mhm.
I think of it like you having your own health or wellness entourage. You have your provider, you have the social worker, people there that are really there to support you in your health journey, right? And
Yeah.
to help ensure that you're able to get quality care, access to treatment services, and just have, like you said, a good experience. I really
Mhm.
appreciated that you stated that. So, what other things can social workers do? Like, can they help me understand or translate some of the things that my provider tells me? Because I've heard oftentimes people will go, they feel like they have a decent relationship with their provider, but then they say, I'll leave and I don't remember or I don't understand half of the things that they told me to do.
Right.
So, can a social worker be there as well, or how? What should I do about that if I don't really feel like I understand the information that's being
Yeah.
shared with me?
So we would explore further what is the barrier. Sometimes it can be a language barrier. Sometimes our provider is a person of a different ethnicity and their first language is something other than English, or maybe English is not your first language either. Sometimes it's an actual language barrier. Now, if it's tips and tools to feel empowered in those like 15-minute doctor's visits, sometimes it's, do you ask all the questions? Culturally, sometimes folks don't question their provider, they just take the information. We would assess what's going on. And they may say they talk down to me or they belittle me. And we can actually talk to the provider and let them know, hey, this is what their experience is. They still don't understand. Can you go back and explain it or have someone else explain it? And so sometimes when your care, you're done with your appointment or you're done with your visit, you're off on your own now. You can let them know, I still don't understand what I'm supposed to do. I still don't understand how these readings, right? Sometimes it's taking your blood sugars, or you have to take some kind of assessments. You can let them know, I still don't know, or it feels like too much. They can work with the team. Sometimes they'll loop in a social worker, or they'll loop in a nurse that can provide additional education. The goal is that you are connected to the appropriate care, that you're connected to adequate care, right? And we won't know that unless you say something. So even if every visit you don't understand, you may want to find a provider who can communicate well with you. It's not always on you, to be honest.
So what basically we're talking about is being health literate. And you shared a little bit, but can you kind of elaborate a little bit more about why is it important to be health literate?
Health literacy is a word that I only ever hear in either academia or in the hospital setting. This is not language we use at
Right.
home when we're talking to our family, like, Grandma, are you health literate?
Right.
We don't use those words. And so if we are using a different language within the system that doesn't translate to the community, that is an error on our part. And so we want to use language that says, are you in the know? Do you understand? Are you empowered? Do you feel heard? So, health literacy, for the community to know, is we want to know, how well do you understand what's going on? What is your ability to connect to the services you need? And how well do you understand the information? The other part is on us as an organization, as an entity. um, to what degree do we provide information in your own language? Do we communicate in a way that you understand, or is it as if we're talking to our peers? So it is two parts. The thing I want to say about health literacy is, it's not something we are trained to do.
Right.
We only become health literate when there's an issue that requires us to become an expert on diabetes management, on whatever cancer you're trying to treat. That's when folks get really literate, is when there's an issue. And there's ways that we can increase our awareness of connecting to care, and from a preventative standpoint. And sometimes we just don't know what we need to know. And with my organization, our goal is to talk about these things, to normalize having further discussions on the type of care we want to receive. I know I want superb care every time I go to the hospital or for an appointment, and everyone should receive the same.
I Yes, yes, and yes. Everyone should. And that should be everybody's goal, right? When they do access care, that they can feel empowered to be able to, ask for what they need as far as healthcare services. But then too, they should be able to know that they're going to receive quality care. So
Right,
I,
right.
that's exactly how I feel too. Every time I go to the doctors, I want to have a good experience and I want to feel like I've been heard and that my needs are being met. So, you mentioned that you were a social worker, and I want to ask you too. This is kind of a little bit off topic, but why do you, or how do you think that social workers, because we don't traditionally think of social workers helping in the healthcare space,
Mhm.
um, so, how can social workers help community kind of address health disparities or understand how to better take care of their health?
Yeah, I come to learn that social workers are kind of like the secret weapon. We have the ability to understand individuals, and individuals in the context of their immediate environment, and also the system. So we have the ability to switch lenses, whether we're dealing with one-on-one person, they're dealing with a loved one who recently passed, or understand, this person is not going to do well because they don't have the supports in their house. They don't have transportation. They don't have family who lives locally. So even the best treatment plan may not work for this person because it doesn't fit their current life structure. So when we think about preventative stuff, it came out with the social determinants of health. Social workers have an understanding of community systems, social injustices, but also resources and relationship building. Part of our success within the hospital, especially around discharge planning, is our ability to connect to people to resources outside of the hospital. To maintain your health, we want you to do well at home. So connecting you to providers or information about nutrition, or sometimes it's even having adequate transportation to get to your routine appointments or your ongoing appointments. And we can do that. We can help connect the dots. And so we know that inpatient, there's a whole team of social workers, and that's when there's a crisis or something really pressing. There's a whole bunch of issues that are outpatient that we can really be helpful in helping people manage, sort through, organize, and making sure you have a plan when you interface with the healthcare system.
I love that. So you're making me want to find out who my local medical social worker is to help me navigate some things in the healthcare
Right?
system. So that this is wonderful information that you shared, Leticia, and I really, really appreciate that because you've helped our viewers kind of appreciate the support and the depth of services that a social worker can provide,
Right.
especially in the healthcare space. And I really appreciate that. And you've also talked and given us definitely some great tools to know how to better navigate and advocate for ourselves in the healthcare space. Is there anything else you'd like to share with our viewing audience?
Yes, I've been able to witness people have a very difficult time navigating the healthcare system. And we just use that word healthcare systems because there's different hospitals, there's different personnel, there's different processes. And depending on your insurance coverage, it may change throughout the course of your life. Having certain tools that can help you with whatever system you're facing, I think can be really life saving and also like stress relieving. And so having a plan in place can look like having an advanced healthcare directive or literally having a plan. And so what my organization does is we help people create plans for medical emergencies. And the ultimate goal is to help reduce medical errors, to really empower Black, Indigenous people of color to be the center of their care. It helps to improve quality care. So again, you want to make sure you have superior care, then you let your provider know. I'm coming here to maintain my health, and I would like you to partner with me in maintaining whatever I got going on or improving it. And so having a plan like an advanced healthcare directive, which is a legal document, it shows their provider, I'm in business, I'm serious. And are you the provider for me to help me stay well? And so I always tell folks, normalize having these conversations. We do have them, but we tend to have them way down the road when it's really overwhelming and difficult. And sometimes the first time we've talked about what kind of care we might want, like life sustaining treatment. So have a plan, have discussions, but in the very least, keep a notebook on notes about yourself or what's going well and what you need support on.
Okay, so on that note, I'm going to have you back for another episode because what you said about doing a directive and making sure you have that plan into place and not being afraid to have those crucial conversations about how you would like things to go in the case that you're not able to speak on your own behalf. That is so important, and that is such a sensitive topic in our community. It
Yeah.
really is. I'm dealing with that in my own,
Mhm.
family, and trying to get people to, like, share with me now while you can what
Right.
your desires and thoughts are around your end of life, care, so that I know, and that it takes the pressure off of a family, in a sense, right? When you've already had that conversation and it's written down and it's documented. So we are
Exactly.
going to put a pause on that because I am going to have you back because I want to go through that in great detail. like even
Yes.
showing the document, talking
Right.
about the different things that are in the document, and how we can start really like sitting down as a family and having those conversations to ensure everybody in the family has,
Yeah.
an advance directive.
Hmm.
So on that, I'm going to say thank you so much
Of
for
course.
talking to us, for helping expand even my own knowledge about the value of social workers and what they bring to, the table as it relates to helping us with maintain our health and wellness, for giving us tips about how to navigate the healthcare system and how to just be prepared.
Right.
I hope all of you listened, that you need to make sure, if nothing else, bring a
Yes.
notebook, but don't bring an empty notebook. Like, bring a notebook that you've, taken notes about yourself,
Yep.
write down things about yourself, how your day was, how you were eating, what your
Mhm.
eating patterns were,
Yeah.
what's your exercise. And I don't like to use the word exercise, I like to say get moving,
And
how
move.
you were moving, right? How you were moving in the last few months since you last saw your provider.
Right.
Make sure that you do that. Make sure you keep those records of yourself so that you can clearly engage in a conversation with your provider and tell them everything that, either like Leticia said, is going well with you, or if you've noticed some changes as it relates to you getting older, or maybe you've sustained some type of, injury.
Yeah.
Keep your doctor informed of what's going on, because that will allow them to best be able to help support you
Yeah.
and provide you with appropriate care. And make sure too, the next time that you're at your doctor's office, if you feel like you need that additional support, ask for a medical social worker
Yeah.
to come and, and help you. So thank you again,
Of course.
Leticia. I so appreciate you. I appreciate you sharing this wealth of information with us. And I want to, like I said, I want to talk, because you threw that in there at the very end.
No, I know. Yeah, just
So
just a little something, for next time, because there are things that people can do, and I've seen it work well for others, and it tends to be white folks who have advanced healthcare directives, and the provider reads it, and it really is helpful, for the provider to have some information. That way, they do what you want them to do if it's within their if it matches the care and the treatment at that time. So there's some ways to make the process smoother. It's newer for certain communities, but it is a resource that we can do and can be helpful.
okay, yeah, I want us to get into it, and I want us to be intentional
Yes.
and have a really dedicated conversation, because I want people to see the form, and us go piece by piece or page by page, to really talk about it, because I'm very, very, I don't want to say passionate, but in a sense passionate about us having those critical conversations, because there's just too many individuals, especially through COVID, that I witnessed,
Right.
losing a loved one, or having a loved one, within 24 hours be in the hospital and then have to go on life support. And the
Mhm.
family, struggling
Like I said, the
because,
timing of things.
right, they didn't know what that person's wishes were, and, not sure what decisions they should make on their behalf. So yeah, advanced directives are so important, and you all stay tuned, because we're going to bring that to you in another episode. We're going to unpack that and talk about it. But again, thank you so much
Problem.
for just sharing, like I said, tips about how we can appropriately navigate the healthcare system and the importance of having that support, especially if you don't feel that you can, navigate it on your own. It's okay to ask for help, and there is help there at the hospital through social workers. So, use your resources, right? Use all your health resources. Why
Use them
wouldn't
up.
if
Use them
they're
up.
available to you and that's what they're there to do? Why wouldn't we use those resources? So, if you
Mhm.
didn't know before this episode, y'all know now that there are people here
Yeah.
and in the healthcare space to help. They're here to help you navigate the system, and help support you in getting the best possible care that you deserve. So thank you, Leticia.
You don't have to do it alone.
Yes, you don't have to do it alone. Thank you, Leticia, for joining me on this episode of Black Facts. and helping me understand and giving us tips on how we can ask for support, the importance of building a relationship with our provider, and how we can effectively navigate the healthcare system. And thank you for tuning in. Please like, share, and subscribe so you can stay up to date on new and upcoming episodes. Join me for the next time so we can all know the facts. Take care, everyone.